Together we achieve victory over heart failure.
Hello, and welcome to our Heart Failure podcast. I'm Dr. Tency Joshu Thomas, an associate consultant in interventional cardiology working at Aster MedCity, Ernakulam, Kerala. Today, let's talk about heart failure, a silent epidemic that India is combating. Unlike the Western countries, where atherosclerotic or block related heart disease and heart failure is commonly seen in the older population, India has witnessed an increase in heart failure cases in our younger men and women. So it's important not just for our older population, but also our younger generation to be aware of this disease and take preventive steps from acquiring this. More importantly, this awareness will help in recognizing early symptoms and seek appropriate medical advice for the same. Let's therefore discuss 5 essential points on heart failure. Firstly, what's heart failure? It is not synonymous with heart attack, which causes blocks in the heart blood vessels and chest pain. Heart failure is actually the heart struggling to pump blood effectively as it should. It doesn't mean that it's the end of life, because when you hear heart failure, you might think it's the end of the heart's life. But that's not the case. It's basically a clinical syndrome which can be easily controlled with medications. The symptoms can be controlled, and in several cases, with the same medications, the disease activity can be reversed. Broadly, heart failure can be divided into two. That is, heart failure due to weak pumping of the heart. The pumping of the heart is measured by something called ejection fraction, and this is done using an echocardiogram. So, ejection fraction is normally somewhere between 60 to 70%. So, you call a person to have heart failure with reduced ejection fraction when the ejection fraction is less than 50. You can also have heart failure with an ejection fraction of more than 50, and that's called heart failure with preserved ejection fraction. Both these entities are equally dangerous and both of them need treatment. Secondly, why many Indians are affected. Genetics does play an important role. Genetics makes us prone for early coronary artery disease, that is heart attacks, hypertension, diabetes, obesity. So diabetes, we are even called, India is called the diabetic capital of the world. It is that prevalent. And many of our Indian diets use a lot of salt, which makes us more prone for developing hypertension and subsequently heart disease. Now, thirdly, how can we recognize heart failure? What are the signs and symptoms? It is not chest pain. Chest pain causes heart attack. Heart failure usually presents with effort related tiredness or fatigue. Most of these patients would present with breathlessness either at rest or while exerting. Many patients also present with swelling of their legs, called pedal edema, or a facial puffiness. In more advanced cases, patients will come with complaints of breathlessness when they even try to lie down flat on the bed. Fourthly, how can we protect ourselves? Remember that the heart works for us relentlessly from birth to death. So it's implied duty that we return the favor and take care of our hearts. So what we can do is make it a habit to go for regular health checkups and blood tests to detect our risk factors for heart failure and also for the early recognition of heart failure. Secondly, dietary adjustments to maintain a healthy heart is very important. Lessening the amount of salt in diet, improving a potassium rich diet, that is using more vegetables and fruits, avoiding maximum amount of junk food is all important in our diet. Daily exercise to keep our heart healthy and keep the risk factors for heart failure at bay is very important. It is recommended that we exercise for at least 40 minutes for 5 days a week. Stress management is important. It can be either through meditation and counseling, or in worst case scenarios, even using the help of medications. Smoking and alcohol and all forms of tobacco consumption should be completely stopped, as it can increase the risk for hypertension, heart disease, and by heart failure. Now, what to do if I get heart failure? Is it the end of your life? Definitely not. All the researchers over the past 40 to 50 years have given us a big, huge armamentarium of medications which can treat and reverse or reduce the symptoms of heart failure such that you can even lead a normal life. These medications for heart failure, which are termed as guideline directed medical therapy, have proven to improve the quality of life and increase your lifespan. In addition to medications, we also have biventricular pacemakers, implantable defibrillators, and in the worst case scenarios or extreme cases of heart failure which do not respond to medications, you can even go for an artificial heart or a heart transplant. These are options available to us even now. So remember, the lifetime risk of congestive heart failure is 1 in 5, both for men and women. It is only through this kind of awareness and a proactive measure in taking care of heart health that we can avert these symptoms and the silent epidemic that is heart failure. Thank you.